Eating the right foods is crucial for maintaining healthy kidneys and preventing kidney disease. For those with chronic kidney disease, CKD, or kidney problems, being mindful of your diet is especially important. Certain foods can put extra strain on your kidneys, cause damage over time, and speed up the progression of kidney disease. Kidneys act as filters for your blood, removing waste products and excess fluid, and maintaining the right balance of nutrients. When kidney function declines, waste builds up in the blood and can make you feel sick. In advanced kidney disease, dangerous levels of fluid, electrolytes, and wastes can accumulate, and the kidneys can no longer do their job effectively. This is when dialysis, an artificial blood filtration treatment, becomes necessary to filter the blood. Dialysis helps remove waste and excess fluid to prevent fatal complications when the kidneys can no longer do this naturally. While dialysis is life-saving, it is also taxing on the body and not a cure for kidney disease. Patients on dialysis have a lower quality of life and reduced life expectancy compared to the general population. Chronic kidney disease is on the rise globally, affecting around 10% of the world's population. Diabetes and hypertension are major risk factors, damaging the kidneys over many years. Genetics, autoimmune disorders, injuries, and certain infections can also cause lasting kidney damage. Age increases risk, with adults over 60 especially susceptible. Once the kidneys are damaged, further deterioration can't be reversed. However, progression of the disease can be slowed through healthy lifestyle changes, controlling underlying conditions, and following a kidney-friendly diet. Limiting high potassium, phosphorus, and sodium foods helps prevent mineral imbalances. Restricting protein is often recommended to avoid waste buildup. While following dietary guidelines, it's also key to maintain good nutrition and not further deprive the body. Making smart food choices can go a long way in supporting kidney health, delaying the need for dialysis, and improving quality of life. It may even keep some patients off dialysis altogether. Each person is different, so work with your healthcare provider to develop the ideal renal diet based on your individual health status and needs. Monitor labs regularly to catch nutrient deficiencies or imbalances early. Now let's look at 10 specific foods kidney patients may want to watch their intake of and possible safer alternatives. Number 1. Red and processed meats. Red meats like beef, pork, and lamb are high in saturated fat, difficult to digest, and taxing on the kidneys. Processed meats like sausage, bacon, and deli meats are further problematic with added salt, nitrates, and phosphates. These can accumulate in the blood when kidneys aren't fully filtering. Opt for leaner cuts of meat in smaller portions. Chicken, turkey, and plant-based protein are gentler on the kidneys. Getting adequate protein is important, but work with your dietitian to determine safe levels based on kidney function. Number 2. Sodium. Excess sodium causes fluid retention, raising blood pressure and forcing kidneys to work harder. This speeds up kidney damage over time. Sodium can also cause dangerous fluid buildup in advanced CKD. Furthermore, dialysis patients retaining fluid between treatments may have blood pressure issues and heart complications. Avoid adding extra salt to foods. Limit cured meats, chips, pretzels, and other salty snacks. Be mindful of hidden sodium in packaged foods, canned items, sauces, and restaurant meals. Fresh homemade foods allow better control of sodium intake. Number 3. Phosphorus. High phosphorus foods can lead to imbalances when kidneys are unable to remove excess amounts. It pulls calcium from bones, increasing fracture risk. Phosphorus may also deposit in soft tissues when elevated, including skin, heart, and blood vessels. Common dietary sources include meat, dairy, nuts, soda, and processed foods. Phosphorus binders may be prescribed with meals to help lower absorption. Limiting phosphorus-rich foods, closely monitoring levels, and restricting protein as needed can help maintain balance. Number 4. Potassium. Healthy kidneys regulate potassium levels in the blood, but impaired kidneys allow concentrations to rise. Excess potassium can cause dangerous heart arrhythmias. High potassium foods include potatoes, bananas, tomatoes, nuts, dairy, and more. Removing potassium through dialysis and medication, while limiting dietary sources, helps control levels. Number 5. Canned foods. Canned vegetables, beans, broths, and tomatoes tend to be high in sodium. Canned fruits packed in syrup contain added sugars. Rinsing canned goods can reduce some sodium, but not enough for those closely restricting intake. Whenever possible, choose no salt added or low sodium varieties. Opt for fresh or frozen fruits packed without sugary syrups. Number 6. Frozen meals. Packaged frozen meals are notoriously high in sodium, phosphorus, and unhealthy fats. The added salts, preservatives, and artificial ingredients create a triple threat for kidneys. Check labels and choose freshly prepared meals over heavily processed frozen foods. Home cooking allows control over nutrients of concern. If using frozen meals, compare brands and select lower sodium options made with simple, whole ingredients. Number 7. Pickles, olives, and relish. These salty pickled foods are very high in sodium, with one dill pickle containing over 500 milligrams. Just a couple olives or a spoonful of relish can shoot sodium through the roof. It's best to avoid these entirely if you really need to watch salt intake. Opt for low-sodium versions if available. Fresh veggies and herbs often make good substitutes, providing crunch and flavor without excess salt. Number 8. Store-bought breads and baked goods. Bread, buns, muffins, cakes, and pastries from the grocery store contain whopping amounts of sodium, phosphorus, and potassium additives. Common additions like wheat flour, milk, and cheese further add to levels of these nutrients. Limit packaged baked goods and choose homemade items without additives instead. Look for low-phosphorus baking mixes made with allowed ingredients. Number 9. Oranges and other citrus fruits. While citrus fruits like oranges, grapefruit, and tangerines are great sources of vitamin C and antioxidants, they are also fairly high in potassium. Just one orange contains over 200 milligrams potassium. For kidney patients on a potassium-restricted diet, these fruits should be enjoyed only occasionally in small amounts. Many other fruits make good alternatives like apples, grapes, berries, and peaches. Number 10. Nuts, seeds, and beans. All nuts, seeds, and legumes are naturally high in phosphorus, potassium, and magnesium. For example, just 2 tablespoons of almond butter can provide nearly 150 milligrams of phosphorus. Those with advanced CKD need to strictly limit intake. However, small portions can be incorporated into the diet in moderation if labs are stable. Stick to recommended serving sizes and avoid overly processed peanut butters and spreads with added salts or oils. There are a number of foods that can be hard on the kidneys and may need to be limited or avoided altogether when living with chronic kidney disease and kidney failure. These include foods high in sodium, potassium, phosphorus, saturated fats, and sugars. Common problematic foods include red meat, processed meats, frozen meals, canned goods, baked goods, pickles, nuts, citrus fruits, and more. Reading ingredient labels and understanding nutritional information is extremely important. This allows you to identify foods high in nutrients you may need to restrict, as well as hidden sources like restaurant items and common condiments. Consulting with a renal dietitian can help guide you further on your specific dietary needs and restrictions based on your individual lab results and kidney function. The right diet helps minimize buildup of waste products in the blood and prevents fluid, sodium, potassium, and phosphorus imbalances. Staying within your recommended dietary limits preserves remaining kidney function as long as possible and prevents complications. This allows you to avoid dialysis longer or potentially avoid it altogether. For those already on dialysis, closely following your renal diet can greatly reduce symptoms and complications between treatments. Monitoring your labs regularly helps ensure you're on track. Making the necessary dietary changes may be challenging at first, but becomes easier with time. Support groups can provide community, ideas, and recipes. Home cooking allows you control over ingredients. Portioning high potassium, phosphorus, and protein foods can help you still enjoy some favorites in moderation. A kidney-friendly diet aims to bring balance, not restriction. Work creatively with your healthcare team to find foods that provide nutrition, variety, and enjoyment while keeping your kidneys in mind. Protect your kidney health by being an informed, empowered patient and making smart dietary choices. Stay positive through this journey, be kind to yourself, and focus each day on doing what you can to support your body. Thank you for watching this video on foods to avoid with kidney disease. I hope this gave you a good overview of many common foods that can be hard on the kidneys, as well as some safer alternatives to enjoy instead. Keep in mind, recommendations may vary based on your individual kidney function and needs. Work with your healthcare providers to determine the ideal renal diet and limits on sodium, potassium, phosphorus, and fluids for your unique situation. If you found this video helpful, please give it a like and subscribe to my channel for more kidney health tips. Thanks for watching, and we'll see you in the next video.